Hello, welcome to any community. In this particular video, we are going to discuss the context of Vikriti Pariksha. So we are going to analyze how this Vikriti Pariksha is being done based on the different parameters as per Charaka Samhita will be discussed in this particular video. When you think about the term Vikriti Pariksha, it is comprising of two different terms, Pariksha and Vikriti. Pariksha, as this is being described in Samskrita words, pramanaihi artha avadharanam pariksha. So that means the analysis of the any of the matter which is going to get examined through different modes or skills or techniques, that is being termed as pariksha. And vikriti, in the sense any kind of the disturbed function or disturbed structure observed in the human body in this particular instance. So that means Vikriti Pariksha, if you add both of them together, that is, they identifying or analyzing any of the abnormal functions happening in the human body, that is being termed as Vikriti Pariksha. When you think about the Vikriti Pariksha, Charaka Samhita says, Vikriti Tashcheti, Vikriti Ruchyate Vikaraha. Any kind of abnormal functioning in terms of the dosha, dhatu, or mala, that is being termed as vikara or vikriti. Tatra vikaram hetu dosha dushya prakriti desha kala bala visheshaihi lingatascha pariksheta nahi antarena हेत्वादीनां बलविशेषं व्याधिबलविशेषोपलब्धिः यस्य हि व्याधेः दोष दूष्य प्रकृति देश काल बलसाम्यं भवति महत् च हेतु लिङ्गबल स व्याधिः बलवान् भवति तद्विपर्ययात् च अल्पबलः मध्यबलः तु दोषदूष्यादीनाम् अन्यतम सामान्यात् हेतु लिङ्ग मध्यबलत्वात् च उपलभ्यते. So that is the Vikriti is going, we are going to analyze by the dosha, dushya, prakriti, desha, kala, and bala. So regarding there, the varying degrees present in the human individual. So we are going to analyze the hetu, that is the degree of the hetu or the severity or virulence of the nidana are going to get analyzed. So here the term nahi antarena hitvadina bala vishesham vyadhi bala vishesha upalabdhihi. So here regarding the hetu and vyadhi, in terms of there is no much difference is being made in terms of the dosha, dushya, prakriti, etc. They are similar. But in other words to say, if you are considering the degree of the vitiation of the dosha or dushya or prakriti or desha, kala, bala, if they are uh, aligning along with each other in terms of the hetu or in terms of the vyadhi, that particular vikriti is considered to be balavan vikriti. If the person is not having the any kind of the alignment in terms of the dosha, dushya, prakriti, desha, kala, bala, etc., then such kind of the diseases are considered to be alpa bala vyadhi. And if there is any kind of the alignment, that is in terms of the dosha, dushya, prakriti, desha, kala, bala, if they are of a moderate degree or medium degree, such kind of the vikara are considered to be madhyama bala vikara. So that is, this is what is considered to be the description told in the Charaka Samhita. Now we are going to learn these with few examples. Suppose if you consider vikara and hetu as such, in these two occasions, See the first instance, the person is going to take the with this amount, then there will be kapha dosha vitiation. Of course, it will be of a milder category. Whereas the another image, the person is going to take the dadhi, adding with these different ingredients. Here, the amount of the Hetu Sevana is much more severe. In the first instance, that is indicative of the Kapadosha vitiation. In the second instance, that is also indicative of the Kapadosha vitiation. But the degree of the Kapadosha vitiation will be different. In the first instance, the person will be having the milder Kapadosha vitiation. Whereas in the second instance, that is considered to be, there will be the much more severe degree of kapha dosha vitiation will be observed. So that means the person will be having the second instance severe form of disease, the first instance milder form of disease. When you think about the vikara and dosha, when you think about this particular part, in the first instance, the person is having the clinical manifestation only restricted to one part of the chest, then it is considered to be mild dosha vitiation. Whereas the second instance, the twak vikara, or what we can say the skin lesions, are present in one side, both the chest and abdomen. In that particular situation, the dosha vitiation will be comparatively a little bit more. In this particular vitiation, vikara and dusya. In the first instance, extreme left image, the person is having the discoloration only up to part of the foreleg. That is indicative of the Rakta Dhatu vitiation, milder form. In the second instance, the person is having a Rakta Dhatu affliction in both the limbs. In the first instance, it is only observed in one limb. Other limb may not have that particular clinical presentation. In that particular situation, the second image, where the clinical manifestations are observed in both the limbs, in that particular situation, the degree of Rakta Dhatu vitiation will be comparatively much more. Vikara and Prakriti. If you take the same example, we are considering the person is having a Pitta dominant disease. Suppose if this is observed in the Kapha Prakriti individual, then it is comparatively easier to cure. Whereas if the same kind of the clinical presentation is observed in Pitta Prakriti individual, then it is comparatively taking much more time or much difficult to have the complete remission of the symptoms. Then this is considered to be same Pitta Prathana Vikara, and if this is being observed in case of the Anupadesha, then it is comparatively easier to cure. Whereas if the same thing is observed in case of the Jangala Desha, then such kind of the disease is considered to be comparatively difficult to cure. As far as Vikara and in terms of the time of manifestation, suppose if this is being aggravated at the midnight, as such, then such kind of the clinical presentation will be considered to be comparatively difficult to cure, because it's a Pitta dosha dominant disease, it's a Rakta Dhatu involvement plus, and it is worsened at mid noon time. So that is all these are indicative of a comparatively much more severe form of the disease as such. Suppose if the same kind of clinical presentation observed at the evening time, maybe this is maybe considered to be either Vata or Kapha dominance. So that means the time period is Vata or Kapha dominant, and the person is having the Pitta dominant disease. This may take comparatively shorter time to have the remission of the symptoms. Vikara and Bala. When you think about this, the person in this particular instance, the person is having the Pravara Rogi Bala. So that means if you are giving any kind of the potent medicine, the person is able to withstand the potency of the medicine. So that means this may be considered to be comparatively easier to cure than the same kind of the disease manifestation observed in elderly individual, wherein the person will be having the milder uh, avara rogi bala as such. That's why the potent medications as such, the person may not be able to withstand it. So when you consider the overall Vikriti Pariksha, in the sense we have to look into Ketu, Dosha, Dushya, Prakriti, Desha, Kala, and Bala Lakshana has to be examined appropriately. If the Dosha, Dushya, Prakriti, Desha, Kala, and Bala, if they are not aligning among each other, then such kind of the Vyadhi is considered to be Balavan Vikara. So that means that particular disease may require intense line of treatment. If there is non-alignment of dosha, dushya, prakriti, desha, kala, and bala are being observed, then the person will be having the alpa bala vyadhi. So that means milder form of the disease can be manifested. If the dosha, dushya, prakriti, desha, kala, and bala vyadhi, if they are partially aligned, then madhyama bala vikara will be manifested in an individual. This how the Vikriti Pariksha can be interpreted. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.